Okay, Hamish, we are now going to the next section, which is the assessment, monitoring and observation. So let's start with the first section, which is what are the indications for a hemodynamic monitoring system in relation to critically ill adults?
Hemodynamic. Hemo means blood. Dynamic means motion by force. Basically, hemodynamic is a transport function of the cardiovascular system. What are the indications for the hemodynamic monitoring? All critically ill patients or ICU patients should be on hemodynamic monitoring. For example, patient who is on inotropes, patient who is septic, patient who has some cardiac issues, all should be on hemodynamic monitoring. There are two different types of hemodynamic monitoring. One is invasive, another one is non-invasive. Non-invasive hemodynamic monitoring includes oxygen saturation, respiratory rate, heart rate, ECG and non-invasive blood pressure. When we monitoring the ECG, we put electrodes red on the right side, yellow on the left side, and just below the red we usually keep the black, and below the yellow we keep green, and in the center we keep white. And moving on to invasive hemodynamic monitoring, central venous pressure measured via central venous catheter and arterial pressure measured via arterial line. There are also some advanced hemodynamic monitoring which includes echocardiography. There are two types of echocardiography, which is transthoracic echocardiography, transesophageal echocardiography, and another type of advanced hemodynamic monitoring is pulmonary artery catheter and flow track. With the help of flow track, we can monitor the cardiac output and stroke volume, which would be helpful during fluid challenge.
That's really a good answer, Hermes. Thank you. Okay, now let's go to sepsis, which is a very interesting topic. All right. What are the identification criteria for? One is a SIRS criteria. The next one is a sepsis criteria, a severe sepsis criteria, and a red flag sepsis criteria. Could you explain about this four, which is SIRS, sepsis, severe sepsis, and the red flag sepsis?
SIRS, systemic inflammatory response syndrome. What are the criteria for SIRS? SIRS criteria are when the patient has following symptoms such as temperature greater than 38 or lesser than 36, or heart rate greater than 90, the tachycardia, or the respiratory rate greater than 22, carbon dioxide level below 4.3, white blood cell counts more than 12,000 or less than 4,000 indicates SIRS. Sepsis criteria includes two or more of the SIRS criteria plus positive evidence of bacteria or virus within the bloodstreams confirmed by blood culture. Severe sepsis criteria includes sepsis confirmed by blood culture plus evidence of organ dysfunction such as lungs, heart, liver, genitourinary tract caused by hypoperfusions and other complications caused by the SIRS. If the new score is 7 or above, and also if the patient has new scores 5 and 6 with either of the following, either lactates is above 2 millimole per liter, or patient had a chemotherapy in the past 6 weeks, or patient has an evidence of organ failure such as acute kidney injury, and patient looks extremely unwell, or patient is actively deteriorating. Whenever any patient met red flag sepsis criteria, please escalate it to the senior nurse in charge or the doctors, because all the patients with red flag sepsis may not require sepsis 6. What are the sepsis 6 management? Give high flow oxygen via non-rebreathable mask. Take blood culture and consider source control. Give IV antibiotic according to the local policy, mostly broad spectrum antibiotics, and whenever you give antibiotic, please check the patient allergic status. Start IV fluid resuscitation, preferably Hartmann, but please follow the trust policy. Check lactate via arterial blood gas. Monitor urine output.
Okay, thank you, Hermes. You did really well with the answers, brilliant answers. We spoke about the monitoring system, which is invasive, non-invasive. Then you spoke about the definition of sepsis. Then you spoke about the SIRS criteria, the sepsis criteria, red flag criteria, and the last one was the severe sepsis criteria. please do not forget, when patients come to in ITU, they're daunted looking at all the wires, the various monitoring devices. Ensure the patients are reassured and provide psychological support, not only to the patient. If the relatives are coming in to see the patient, reassure them and explain to them that the patient is being monitored with various monitoring system and the drugs running in ITU. So you're preparing them to see the patient. Okay, could you tell me, how do you assess the patient's cardiovascular system status?
Cardiac vascular assessment, which includes heart rate. The pulse we usually assess in radial, ulnar, brachial, and in the lower limbs, mostly femoral or pedal pulse. ECG, we usually do 5-lead ECG monitoring in the ICU, and blood pressure including MAP. If the patient is on inotropes, we prefer invasive artery line monitoring. If the patient is not on any inotropes, we usually go with non-invasive blood pressure monitoring. Temperature can be measured via core temperature or axillary temperature, oral temperature, or tympanic temperature. Urine output we measure every hourly in order to assess the kidney function and the perfusion of the kidney. We expect the urine output to be at least 0.5 ml per kg per hour. For example, if the patient weighs 60 kg, we expect at least 30 ml per hour. Then fluid therapies, we look for patient cardiac output and stroke volume. According to that, we give fluid challenges and we give maintenance fluid. Capillary refill time, how do we check it? We hold it for 5 seconds, 1, 2, 3, 4, 5, and when we leave it, how quick the blood recover. And usually capillary refill time should be less than 3 seconds. Skin turgor, how do you assess the skin turgor? When we pinch the skin like this, if the patient is dehydrated, the skin stands up even after we leave it. As you can see, I'm fully hydrated, so the skin goes down very quickly. Check patient's upper limbs and lower limbs, whether is it feeling warm or cold. Then we look for the blood results such as full blood count, clotting profile, LFT, CRRT, urea, creatinine, and we also look for the biochemical markers such as troponin, lactate, CRP.
Hermes, the answers were really brilliant. Just don't forget about the use of mixed venous sats. So you'd go to the central venous line, your CVC, and look for the distal lumen. So the distal lumen, you're going to take some blood and run it via the gas, and you get a mixed venous sats. Any mixed venous sats above 70 is excellent. That's a normal value. Any mixed venous sats below 60 should have fluid therapies to be initiated. So patient could have fluids. In the absence of any advanced hemodynamic system, yes, you would look into all the other factors. As you said, you're looking for mainly the peripheries, whether they're warm or cold, capillary refill time, or your patient looking pale. So then you can even give some blood instead of fluids. Thank you very much for fantastic answers. Let's go to the next question.